Hi, everybody. Welcome. Good to see so many of you all on this Sunday morning. And I'm hoping we have all women. And of course, I'm sure there are some men also who've joined their women because our topic and our speaker today is so interesting. So while we wait for all of you to join in, we're already about 5 minutes behind schedule. So let me get started with today's agenda. And can we have everybody muted, please? So here we go. This is our first initiative, and many of you all know and are connected to us with this platform, which is officially launching today. It's called the Women in Dentistry Education Network, or WiDeN, as you guys know. And many of you all are part of the WhatsApp group already. For those of you who aren't part of the WhatsApp group, if we can have the link of the WhatsApp group posted in the chat, please join this group. Currently, we have two WhatsApp groups already. And the idea of this seminar actually originated on one of these groups where Dr. Sanghmitra was so kind and gracious to actually offer us her knowledge and make it an exclusive women event. And that's why we're all here today on this Sunday to learn about this innovative new concept called bioengineering. Many of you all must have seen the live already, and the live that we did together was addressing some basic concepts on what are the indications, contraindications, how this entire concept came about. But today we're going to dive deeper and actually understand how we can apply this in our practice. So, for those of you who have patients who come to you with requests like, what do I do for my migraine? What do I do for my jaw ache? I have clicking in my jaws, or even other postural problems, which you probably didn't even know had any connection to dentistry. That is what we're here to learn about and solve today. That this is just more than regular dentistry, it's way beyond, it's holistic. So, while you know a little bit about the topic, let me formally introduce you to Dr. Sanghmitra Dasgupta. I have not met her in person, but here we are all online, and it feels like we've known each other for years. And from an early time in her career, have followed her, progress. And here are some of the highlights of her CV. So she graduated as an oral and maxillofacial surgeon from the SDM College, Dharwad. She's a fellow and diplomate, ICOI. She is also a fellow at the ISOI, the International Society for Oral Laser Applications in Germany. She's a diplomate for human anatomy at the Lille University in France. She also happens to be one of the founder members of the Global Oral Implant Academy Germany. And while I'm saying all these things, I want all of you women, especially, to be inspired by the number of feathers she has collected in her cap. Because one of our purposes here today is to make sure that we also transcend the normal boundaries of our careers and become go-getters and power women, like some of the ones that we are going to be sharing the stage with. So she's also a consulting implantologist at the Regency Medical Center at Dar es Salaam, Tanzania. She's a consulting implantologist at the Elite Dental Clinic in Tanzania as well. Now, she's the course conductor at the Dental Concepts, Hampshire, UK, and she is the first face and posture analyst of the country with more than 150 documented cases, some of which she will be sharing with us today. She's also a director at her clinic Core Dental Face and Hair Care in Bangalore, India. And she's associated with academics since 1997, has undergone extensive training abroad in implantology, aesthetic dentistry, laser dentistry, facial aesthetics, and neuromuscular dentistry. So, need I even say more? I think I just should welcome her onto the stage today, and she can take away the show and teach us all about bioengineering in dentistry today. So, welcome, Dr. Sanghmitra.
Thank you
Happy to
so
have you
much.
again.
Thank you, Diksha. Sorry, again, I refer to you as Diksha. Since we all are doctors, I think it's all okay to be
Absolutely.
with permission. Yeah, thank you
Absolutely.
so much. All right, so let's get started. First and foremost, let me thank you, Diksha, that you put everything together and made this possible. Knowing me that who is doesn't like so much being on the social media and stuff, and you're making me do this itself, the entire credit I give it to you. And
Thank you. We're so
yeah,
happy to have you with us this Sunday. It's absolutely our pleasure.
thank you so much. So let's get started. Is it okay now? How many people we have? About 23 people. So shall we go ahead and start?
Yeah, I think we have people joining in, but we also have a recording of this, so we can always share
So
that. So
later
you
they
please go
can.
ahead and start. Yes.
Okay. So now I have to go to my slides, right?
Yes.
Um,
You can just share
Share
screen.
screen, yes, share
Perfect.
screen, and there I am here. Okay, share. So is the slide visible?
Yes, absolutely.
Yeah, we are okay. So so what is bioengineering? Oops, how am I taking? 1 second. How do I take it? Move it forward. Slide. Okay, here I am. Okay. So when we talk about bioengineering in dentistry, what does this mean? See, you must have seen in social media those pictures about dentists, what's the full form of dentist. D stands for doctor, EN stands for engineer, and the IST stands for artist. So we have been doing that for all our life. We have
1 year wiser.
There's some disturbance.
We have found that few people
We'll go ahead and mute the whoever is
I
unmuted.
can
So
continue
you
this,
can
right?
continue. Absolutely, yeah.
Okay.
And a request to all the participants, please be careful. Just mute yourself so that we don't have these repeated disturbances. Thank you.
Great. So I was talking about the doctor and the artist part, which all our life we have been doing. But what is required is uh, the engineering part of it. We do keep doing some of the engineering part of it, but then some of us have taken it beyond. And I think I became the first face and posture analyst because I think I recorded all my cases. I have documented all my cases, and now it stands at more than 150. The cases are going on, and most of them are completed. This journey started way back in 2012 of documentation in a bioengineering way. But the main documentation with the face and the posture started in 2017. And at the very outset, I would give the credit to Maria Silak from Budapest. As we were other day also, I mentioned her name. So let's get started with bioengineering and the concept of it. I'm going to start with spine. Now, if you see the spine, this is the cervical curvature of the spine. It has 4 parts. This is the thoracic part, this is the lumbar curve, and this is the sacral curve. Now, if you will see that most emphasis I'm laying on curvature, which I'm going to talk about a little later. So this spine in Sanskrit, it has a name. It is called as Merudanda. Do you know why we call it Merudanda? Meru comes from a famous, in our scriptures, it's mentioned that it is a holy Mount Meru. It is said that the axis of universe revolves around Mount Meru. Mount Meru is known for its physical, metaphysical, everything revolves around Mount Meru. So Mount Meru has that significance. So likewise, our spine is the axis of our body. Everything routes through spine. You talk about our actions, our sensations, our breathing, our functioning of our every organ. Every single thing is routed through spine. Spine is also called as the communication center between the brain and the rest of the body. So having said that, now where do we come in picture? This, the tooth that we all know, that the tooth that first comes into the mouth is the first molar. Have you ever thought why first molar tooth comes into the mouth? I kept asking this question repeatedly year after year to so many senior, junior, dentists, everybody. But nobody could give me a satisfactory answer. Orthodontists will say that, oh, it is a key of occlusion. They actually knew the significance, but the why it comes first, nobody could tell me. So later on, when I started working on, I found out the significance of first molar tooth. Now, if you see here, the sixth, first, this is a, if you remember our orthodontics in our undergraduate level, we studied this classification engraver. What was that? Angles classification 1. This is the class 1 relationship. If you see that, if there is a class 1 relationship, as is indicated by this arrow, the posture, head remains straight, head is firmly on the neck, right? But if there is a class 2 relationship like this, irrespective how the front teeth are, head tends to fall forward. This situation is called as kyphosis. And then if the relationship is class 3, head tends to fall backwards. It's called as lordosis. You know how the lords would walk with the head held high with a lot of attitude? So the head tends to fall back in this case. This is called as lordosis. So this is the function of, this is the significance of first molar tooth. Now let's understand there is something, okay, there is something else also other than the significance of first molar tooth, which would be required for bioengineering. And what is that? You see, a lot of us keep the head to one side. Have you ever thought why does that happen? It is because of this, the way neck turns the head to one side. So that is why we have a head turning to one side like this. This is what all of us think. But also think of this, that there is a midline shift here. That means the mandible has actually moved to slightly to the right side, which is causing the head to move to one side, right or left. And this facial asymmetry, the right and left, was what makes a huge difference in bioengineering. Now, see, this is the sagittal plane. Sagittal plane divides the body into right, left, and also it divides this portion from here to here, and this portion from here to here should be equal. And from here to this part of the ear and this part of the ear should be ideally equal. Does it happen all the time? The answer is no, because let's go by this 80-20 ratio. As long as 80 to 80% of symmetry we have, we do not have any medical issues. We look good. Everything is fine. Our metabolic rate is fine. BMR is high. Not let's say it's optimal. Okay, and everything works to perfection, almost perfection. But if this is beyond 80-20 ratio, is disturbed, it goes 70-30 or 60-40, then there could be that there are problems. Now, look at this. This is the original picture of this girl. And if I cut it half and superimpose onto the right, this is how she looks. And this is the left superimposing to the left. They all look like sisters, but none of them look exactly like this one. So this tells us there is a facial asymmetry, right? Now the muscles are activated. Now you see the difference. Here, look at the masseter muscle, so powerful, right overlap on the right. And here you see how petite she looks. She looks like a younger sister of this one. So this is how our right and left asymmetry causes a lot of difference on our face. And not only this, we are talking, we live in an aesthetic world, we talk so much about aesthetics, but this also have a huge effect on our spine. Spine can handle about 4.5 to 5 kilos of muscle force. Now, when I say muscle force, the muscles bring about movement and ligament limit the movement. So any action which we do is brought about by muscles and it is routed through spine. Every action is routed through spine. So when the muscles become activated and the forces become more than 5 kilos, there's going to be a slight pressure on the spine, more than 5 kilos. And when it goes beyond that, beyond the handling ability of the spine, that's when the problems start. That's when the aches and pains and the medical ailments start. So see this. Now, this is another thing which, this was a study done by BBC, I think almost 10, 15 years ago. They actually saw 100 people just from the street, and started examining them. And they found out that the line that passes through the interpupillary line and the occlusion plane is parallel to one another. And this is also parallel to the shoulder and goes all the way till feet. But you must be wondering, why is it like this? It's because over a period of time, if the person has scanned, the asymmetry is so much that the muscles get affected so much that the spine bends. And when the spine bends, the hip gets lifted, and that's when you will see that this parallel line changes. And it will also impact the knee as well as the toes and the ankle joint as well. So there was another thing which I would like to mention, that once you have attained certain height, some people over a period of time begin to look shorter. Have you ever thought, how come once you have achieved a skeleton system, once you have attained a height, how can you look shorter? This is the reason, because your spine starts bending and then you begin to look shorter. Okay, now, are you able to see my slides? Because I see a lot of stuff on the, yeah.
Yeah, we can see them clearly.
Okay.
Yes.
Now, if you see, this person's head is slightly bent to the right. Okay. Now, when I took the posture picture, look at the feet. You see that one foot is out, right foot is out. And then let's see what happens in the mouth. This has to be a virgin mouth. When I say virgin mouth, that means the person has not gone through orthodontics. Now, if you see here, this is a midline here, but her midline has shifted, slightly gone to the right. You see that? And you saw that how the face is turned to the right side, and you also saw how the right foot is out. So you see how the head to toe, how everything gets affected if your midline is shifted. Now, what is the other guidelines for bioengineering? We have to have anterior guidance. When I say anterior guidance, what do I mean by that? In anterior guidance, when we bring the jaw forward and we touch the incisor teeth, all the other teeth must disocclude, right? And then this feature has to be there. And if it is not there, we have to create in bioengineering for the muscles to be more effective, for the retraining of the muscles. Okay. Now, if you see here, this is a canine guidance, is again important part of bioengineering. This is a barrier so that the lower jaw is contained within the upper jaw, and it's not allowed to shift. And if this happens like this, see, it's a group function. In this, the masseter muscle will become very, very powerful. And the masseter muscle is the most powerful muscle of the body. And imagine this most powerful muscle can create possibility. There is a possibility that the masseter muscle is responsible for causing a whole lot of asymmetry in the body. And we all already know how it causes clenching and how it causes migraine and stuff. So when I mentioned about curve, I told you in the beginning itself, the cervical spine has a thoracic curve, it has the cervical curve. So what is the significance of curve? This is called as the everything in mother nature, or if it has to be stable, it has to be in the form of arc. Now, imagine a scenario when we talk about, say you buy the best of the vehicle, very, very powerful vehicle. And how many years would it last? Maybe 20 years, 30 years? And mind you, you are not driving this vehicle 24/7. You are driving only for a couple of hours, or maybe 8, 9, maximum 12 hours, but you are not driving it 24/7. But our body is functioning, it is at work 24/7. So you see the engineering our creator has created, and you see the engineering are what we do. And despite all the use and abuse that we subject our body to, we keep functioning perfectly, unless till a level that the muscles become so much harassed that they are no more able to function. And that's when the the spine is overloaded, and that's when the problems, aches and pains begin. So let me show you something. See, our body is arc into arc from head to toe. Look at this. This is an arc. Look at this. This is arc. This is arc. And even the way our jaw movement is in arc, the way teeth are aligned in an arc. Look at the ribs are in arc. Look at the pelvic girdle is arc. Knee joint is in arc. Even the feet are also in arc. Flat foot. If the person has flat foot, they are not admitted in army. You know why? Because if the person is flat foot, they are not strong enough. They will not be able to absorb day-to-day shock. So when I mentioned, if our spine, look at the spine also has an arc. If it was a straight rod, probably it wouldn't have been able to withstand the day-to-day activity. This flexibility, this arc allows the flexibility, it gives strength. So it makes everything all powerful. And that is why, that probably is the reason why we are so strong. Now, this is a deviation from the arc. If we keep this arc kept like this, probably this person will go downhill much sooner than others. So a missing tooth is a break in the arc. We have to make sure that everything has to be brought into arc. So the principle of arc is important. So postural problem more in Asian? The answer is yes. Why? What is the reason? The reason being we are short facial types. Our muscles are much more powerful than the other races. Have you seen a lot of, especially the people from the yellow race? If you see, they look very nice till the age of 40. Their skin is very nice, and suddenly they go downhill because of the muscle power is so much that it overtakes. Then is there a genetic predisposition? This answer is yes. It gets passed to the kind of bite we have, it gets passed on from parent to the children. Can this be prevented? The answer is yes. If we start very early in children, it can be prevented. Can this be corrected? Yes, the answer is yes. Now I say it with a lot of confidence. Earlier, I used to think that there are certain conditions where we cannot correct it, but yes, only thing which I would say, the periodontally compromised teeth, where we're going to keep those teeth. Only in those cases, bioengineering may or may not work, but rest of the cases, we have made it work. So I would say with great pride that yes, it can be corrected. Then habit. Why do you think that the habit, it's not that it's just the occlusal, just the way teeth are, everything is, you fix that, everything is going to be hunky-dory, everything is going to be fine. The answer is no. Habit contributes a lot in postural problems. About habit, it is said that if you remove H, a bit remains. If you remove A, bit remains. If you remove B, it still remains. Why do we say that? It's the reason being, it's very difficult, very, very challenging to create a habit and to give up a habit. But once you do it for 21 days, then it becomes you create that habit. And if you do it for 100 days, it becomes your lifestyle. So why I'm laying so much emphasis on this? Because along with bioengineering, we just not a bioengineered dentist. We also have to be a counselor. We have to be constantly telling the patient to correct their posture. Now let's see what happens. This is a picture which when this artist drew it, probably he didn't even realize, but as a bioengineer, we can tell the difference. Look at the posture. It is so good. And look at the child. It's sitting upright. Look at this bad posture because the mother has bad posture. How these gadgets are causing so much problem in our day-to-day life, in our lifestyle. Let's see what happens. Now, all we women, we love our selfies, right? And also what we do is we know that which side looks good, either the left or right. Now, if you see in my face, my left eye is, more bigger, wider because of course, there's asymmetry. So the left eye is better. So I always take my selfie from the left side. So what happens when we all do that? One side we like more, we keep doing that. It slowly gets into our subconscious. And even while talking, while doing anything, we try to showcase the best side forward. And that becomes a challenge in the asymmetry in the posture. So what that is going to do is it gets into your subconscious, and day to day you continue to do that, and over a period of time it is going to haunt you. It is going to cause aches and pains. Now this is about the selfie syndrome. Now look at this. As I said, spine can handle 4.5 to 5 kilos of force. Now as you continue to do that, it can go up to 27 kilos. These days kids are doing the online classes. We are doing this on Zoom. If we do it constantly and keep bending our head all the time, it can go up to 27 kilos. Now, here I would also like to mention, since we all are dentists, if you are not using loops, if you are not using ergonomic chair, this is how we bend. This is how we put our head into patient's mouth. This is how we do it. So imagine if you are doing this, you know, yesteryears, if a lot of doctors walked out, you could tell who's the dentist because we practice standing dentistry. And the head would bend so much because you would see the dentist would always have a bad posture. So my advice to you all is start using loops and use a ergonomic chair. You can increase your longevity, you can improve your functioning. Now, these are the other things. See, on day-to-day activities, what we keep doing. If your TV is not placed properly in front of you, what you would do, you would lift your head. Computer monitor, iPads, and even it becomes so much part of our life that while walking, running, talking, breathing, doing all kind of things, we keep our head held high. So what happens when we say that occlusion is dynamic? It is because of these muscle pull. We actually shift our jaw, and as a result of it also cause overload on the spine. And this, if you see this person, if you see, he's not fat, he's a very lean mean guy, but you still see this fold in the neck. This is an indicator that this person's occlusion is affected. This is the indication that this person has some or the other medical problem. If you see something like this, this is again a posture which has to be corrected. Now, as I said, cervical spine is stabilized by our first molar tooth. Okay, so cervical spine caters to every activity is routing through spine. So every part, cervical spine has a different function. The thoracic has a different, the lumbar has different, sacral has different. They are catering to different parts of our body. The cervical spine, the area that it caters is the head and neck, shoulder and arms. So you will see all the problems. You see headache, vertigo, tinnitus, jaw pain, sinusitis, watery eyes, frozen shoulder, tennis elbow, neck pain, spondylosis, sore shoulder, radiating pain in arms, snoring, sleep apnea, numbing of fingers, chronic cough, and then hormonal issues because we have thyroid in the neck region, then acidity, weight gain. The entire spine is connected from cervical to, it is connected with the brain, cervical to all the way till sacral. Now, what is going to happen? It is going to transmit it to the upper back, causing upper backache, lower backache, chronic fatigue, degeneration, because there is so much overload, spine is not able to handle it, and it causes the degeneration of spine. Now, have you ever thought that why should we have deciduous teeth? Why is our creator that crazy? He could have given us permanent teeth, right? 1, 2, 3 straight away permanent teeth. Why did he give us deciduous teeth? Have you ever thought about it? There is a reason why this super engineer, why he has done this. For everything, there is a reason. See, up to the age of 5 to 6, our spine is in a formative state. And after that, it requires stabilization. That's when at the age of 6, our first molar appears and causes stabilization, and it stabilizes the head onto the neck. And then rest of the pearls appear and complete that arc. So this one principle of arc comes into play. So the 5 to 6 years is the spine forming, and now after the age that it grows and it is stabilized. So the deciduous teeth have only that much strength. The mineral part in the enamel is only that much. If it is more powerful, probably it could bend the spine, forming spine. So to protect that, we have only the deciduous teeth with so much mineral. And then we have powerful mineral teeth with the in the form of permanent teeth. So this is the significance of deciduous teeth. And for a lot of us, please give lots and lots of importance to deciduous teeth, because they are laying the foundation for how the permanent teeth are going to be, how overall health of the person is going to be. So if you see this child, parents, a lot of parents think that the baby teeth are going to fall off. Why pay any attention to this? So if you leave the child like this, we all know what is pseudo class 3. When this vertical drops, the jaw translates forward. And this child, you can see it's almost establishing the contact here. It's just because we were taking picture, we asked her to push, but she brings it much more ahead. And you can see all the teeth are gone. In this case, she is only 7-year-old, and you can already see the first molar tooth is collapsing. So that means it is just because she lost the architecture of the deciduous teeth, she is going to go into the lordosis. And at this age itself, she has severe lower backache. She wanted to take up dancing. She could not take up dancing solely because of the problem. They thought she had a problem with the spine, but I would think that this is the major contributor. If this was fixed, probably she could go back to her dancing. This is another issue which we see, deep bite in children. Every third or fourth child like this, if I see, and we do the airway mapping, we have seen that those kids are sleep apneic. Now, how do you identify a sleep apneic child? Child is either going to be hyperactive, or he's going to be very sluggish, all the time sleepy. Their grades will fall in the school, and the parents would always tell that this child's focus is not there. He or she does not focus in the work. It's because the child is sleeping most of the time, but the quality of sleep is not good. And we all know that sleep is most important. It is rejuvenating, it is regenerating. So when the child has a bite like this, what's going to happen? It invades the tongue space. Tongue falls onto the airway, and we know we have tonsils, and if there is an inflammation of tonsils, that further contributes in compromising the airway, and the child becomes sleep apneic. Now, if the child has space between the teeth like this, is it good or bad? The answer is it is not good, because the child does not have anterior guidance. The child does not have the canine guidance. The lower jaw is free to move. And when the lower jaw moves in any direction, it will also turn the spine in that direction. So, and most likely this child will become lordotic if this is not controlled at this stage. Then we have a situation like this, anterior cross bite. This can be, there is a drop in huge vertical drop here, and this can be fixed orthodontically. It can be easily fixed, but this situation could have been prevented if this was caught early in the deciduous stage. We don't need to put those the headgear and the chin guard or whatever the orthodontists use. We can control this. So now I showed you so many things. So what is the treatment protocol? Treatment protocol starts from outside in. We do the face and posture analysis. We also check how the person is walking. We collect pictures. We collect study models. We do the intraoral scanning. We take radiographs, CBCT. We do the proportional airway analysis, and then do the treatment planning according to the problem that we see. So to start with, we have first thing is the RIO, removable ideal occlusal splint. Why we want to do that? We don't want to touch teeth. First thing, we want to deprogram the muscles. When I say deprogram the muscles have acquired certain way of functioning, and we have to make that muscle unlearn that. So unlearning takes about 4 to 6 months with this RIO. And how do we make it? After we have done the face analysis, and then we know which side the jaw has shifted. So we record the bite on the opposite side. And first we calculate that, and how we calculate that, for that there's a formula, and this is how the RIO looks. You can see if you have made it for the lower jaw, this is the central fossa line, and this is the central fossa line of the upper teeth. what happens in the buccal cusp falls onto the central fossa of the upper jaw, right? And the palatal fossa falls onto the lower. So these are the two lines which you have to create. This line is of the canine guidance, and this what you see here is for anterior guidance. This is how Rio looks. It's a functional one. So what is it that how do we start? How do we record? This is the gentleman called Shimbashi. He is of American. This one based in America, but from Japanese origin. And he gave a dimension. He calls it 19 millimeter. Now, where is that 19 millimeter? This measure from this part of the mouth. You should keep it at cemento enamel junction, because even if the person has a recession of the gum, keep it at CJA, and then here, lower jaw, and then measure this. This measure should be 19 plus minus 1. This is called Shimbashi. This is your first reference point to calculate how you're going to make your Rio. And now this is how, and then let's talk about how the bioengineering begins. We start at very early. This child was late. We could have started very early. This is what is the starting stage, and this is where we have actually expanded the jaw. And how we did this is very common. This is the appliance which is given to the child, and then we activate within 1 month, there is an expansion of the jaw. So this is also bioengineering. Then this is where the child was, and this is where we have taken to the child to. Now look at this. In conventional dentistry, what we have been practicing, we allow we either put the headgear, or we basically want to prevent the lower jaw from going forward. So, but in bioengineering, I have treated her differently. With the top jaw, I did the wax pattern, and after that I converted into these overlays, and then this is what I created. Basic idea was to create the anterior guidance and the anterior barrier and the lateral barrier. That is very, very important. Side barrier and the front barrier is very important, because you do not want the jaw to grow. And what happened, you can check. Now, if you see here, she started showing her teeth, and if you see the profile, you see the dish. She could not close her mouth, but you see here, there's already improvement, and this is how we are able to restrict the jaw growth, the lower jaw growth. And I'm still monitoring her. She's not come back out. It's almost a year, but I would like to see what's happening, and then maybe I can update you. Now, mouth breathing. What happens in mouth breathing? Now, this gentleman, he has gone through ortho. He has gone through Invisalign, but still he has open bite. So now what could I do? He said, doc, you do anything, but I don't like my gums swelling up, and I don't like my mouth. My gums are always swollen up, and my mouth doesn't feel fresh. This was his main complaint when he came to me. I said, I wanted to do the bioengineering with orthodontics, but he was not ready for it. So we treated this boy with overlays. And after that, he also had, when I did his first set, and his mother came to me, and I actually thought something went wrong. But she came and gave me a hug. She said, my son had a watery eyes. He had severe sinusitis, and I subjected my child twice for his nose surgery, because the ENT guy said it's a deviated nasal septum polyp and this and that, but nothing affected. Every single day he suffered from sinusitis, his headache. Every day I made him do those jalniti. But after what I have done for him, all the problems disappear. So let's see how he looks. This is how it was, and this is how I did the overlay with the resin, and I created this. You can see that even the midline, I have brought it in, and it is in guidance, anterior guidance, and the canine guidance. So this is what happens. You can create magic like this. And this is how it was. His mouth was open, and this is how now the mouth. See the lip, the curvature it has taken, it looks much more aesthetic. Now, as I said, we have a lot of hormones in the head and neck area. This area is called as a sella turcica, wherein our pituitary, our master gland, is sitting. So when the neck turns to one side and neck is, or our spine is overstressed, even our spine, even our hormones start acting up. Even our, the hormones, happy hormones also get affected if there is a lot of compression on spine. So let me show you what happened to this girl. Look at her jaw like this. And after bioengineering, it was straightened up like this. Her airway improved. And also 70% of her thyroid issue that she had got corrected. And jaw pain, again, that is very common in dentistry. So I'll show you this kid. She was suffering so much with jaw ache. You can see the lips are so dry. I would have loved to show the eyes, but I definitely don't, maintaining patients' privacy, I didn't want to do that. But she was in so much pain. And after doing this treatment, there is little, and this is purely with Rio, nothing done in the mouth. Purely with Rio, you can see that how the jaw is taking shape because the pain is gone, because the muscle is deprogrammed. Lower backache, look at this. Look at this square face, how powerful her masseter muscles are. And after reprogramming, after retraining the muscles, it becomes more of a U and her backache disappeared. The neck pain, this lady, look at her. I showed you this picture before also. This is how it was. This is how this is now. She's 63 years old. And this is how she smiled. And this is what we could create, her smile. That was not the intention, honestly, but it was just to actually, and she also had a compromised airway. We were actually working on airway. She had fairly good teeth. She had teeth like this. Who would work on this? But we purely worked on this, and this has been overlay on nothing. I don't cut teeth. I only create finish lines. That's all, because already I'm creating a height. I want to preserve much more of my enamel. Even when I do root canal, I don't give crown. If at all it's required, I would just give an onlay, because we are moving towards the bioengineering. Bioengineering is all about minimal damage to the teeth, because as a bioengineer, I understand the value of enamel. Enamel has 8 to 9 times more mineral than the rest of the mineral in the skeleton system. So if you take away that enamel, if you take away, you shave off that enamel, that much of strength of the person you are bringing down. If any of you know about kinesiology, if suppose I have done, say she has a crown here, she has a root canal done here. So you saw this case initially also, I showed you her midline shifted to right side. So this is an indicator that even when you do kinesiology, the side which has a crown or the root canal, that will be less stronger compared to the other side. That is the power of enamel. So you don't want to cut enamel, you want to preserve maximum enamel. And this is, I showed you this before also, how her leg was out and now the leg has straightened up. This person was considering knee replacement, but now her pain has gone down by 60 to 70%. And now, this we already discussed, that how the parallelism goes from interpupillary line to the occlusal line, ophreal line, this is eyebrow line, then the line passing through the shoulder, then through the pelvic girdle, then the knee, and then all these lines are parallel to one another. And that is how, by fixing the occlusion, by reprogramming, by retraining the muscles, you can fix the person from head to toe. Now look at this gentleman. Look at his head turned to one side. And look at his sternocleidomastoid muscles. You see that here it is more prominent, here it's because he's tilting to one side. And this is when he came to me. He's a case of cleft lip and palate. He had this alveolar cleft. So wherever he was going, the person was fixing his teeth. He gave him a bridge here, then he gave him a bridge here, and most of the back teeth he lost. He had one big window here. He was losing bone here. So when I treated him, this is what I created. You can see the nose looks like, actually, when he went back from the clinic, somebody asked him, did he go through the nose surgery? See the rhinoplasty, non-surgical rhinoplasty, how beautiful, triangular nose it is, and you can see how flat it is. So this is the beauty of bioengineering. And this is the smile which I gave him. I thought it was very broad here, but it was already actually very prominent in his case here. So I toned it down. It looks much nicer now. And what did I do for him? I actually I worked only on one jaw and partly on the lower jaw. No, I did not touch his front teeth. I put these overlays on this teeth, and this crossbite which he has. Actually, I was planning to do the alveolar grafting. I was thinking of taking the graft from the hip and put here and do implants. And these teeth were actually shaking. But the moment I did this and I fixed here everything, see what I did here. He had a bridge here and this tooth was failing. Okay, I cut it here, and I left these two teeth as such, and I put an implant here. At the back, I put implant, and here I have actually the crossbite I've corrected. And if you see here, the top teeth he lost here, and the two implants I placed here. And this is what is the radiograph. So you see, the beauty of it is that the moment every principle was put in place, everything sorted out. I didn't have to do the alveolar grafting for him. And another beautiful thing that happened, his leg was like this. We did talk about this, Diksha, when we were talking. So his leg was like this, and see what happened to his leg. This was before the procedure, and this is after the procedure. Do you see this leg?
Wow.
Has yes.
The bow legs have straightened.
Leg has straightened up. Can you imagine how powerful as dentists we are? We all the time we keep cribbing and sulking. There's nothing in dentistry, nothing in dentistry. I feel that we actually rule the rules. If we we have so much of potential to grow. If we apply it, we can create magic. Then,
absolutely.
Yeah, so this person, the hip pain also can be addressed. Now, this boy came to me from Scotland, 43-year-old, and his mouth was like this. He was wearing dentures, and it was a perio mess. So I don't like to pull out all the teeth. I'm not a believer of the all on four concept. I like to have as many teeth, even if I can save 3 or 4 teeth also, I go ahead and save teeth because of the enamel, the mineral content in the enamel. So this is how I treated him. I preserve these teeth, and I created this. So this is the result. I could get this, and it's still, the lip is collapsed inside. You can see here, it's because I could not load those implants. Rest of all the implants I immediately loaded. But look at his jaw shape. Look at the way it has taken a nice dimension. But the best part is when he came back, he said, "Doctor, my hip used to hurt a lot in the morning, but that pain has reduced by 60%. So, I mean, is this the treatment which I did for all these ailments which I'm mentioning? The answer is no. I only fixed the mouth. I only reprogrammed or deprogrammed the muscles. But all that happened, and that caused the stabilization of the spine, and the end result is for you to see here. Now, the acidity. Now, why do you think acidity happens? See, when the tongue space is invaded, we have a food pipe and windpipe in our neck, right? So when the tongue falls onto the airway and the food pipe, the stomach thinks there is a food coming in, but you're not taking inside any food, but the stomach has already produced the acid. So that acid starts eroding the tissue around, and eventually it manifests in the form of acidity. So how do we deal with this? This gentleman came to me. See, so a lot of time, I wouldn't say we do it intentionally, but I also feel that a lot of time we are responsible for causing problem in patient's life. You know how? Look at this. This gentleman, this dentist placed some implants in the lower jaw and asked this patient that we can't load this and you have to be like this. You have to be on soft food for 6 months. So that was okay. He programmed his mind to have soft food for 6 months. But what happened? This person stopped sleeping. This person started getting severe acidic attacks. He was miserable. He thought as if he is getting heart attack. So he went back to his dentist. Dentist said, no, it's fine. You're healing well. You just continue to have, or eat a lot of curd rice and this and that, have a lot of yogurt. It will help you calm down your stomach. So then he goes to another dentist. Then from there, he went to ENT, he went to chest physician. So like this, he kept on visiting, I think 6, 7 doctors he saw. And when he went to the chest physician, he said, I have this doctor who does, some of my work where people are not able to, he gave him for CPAP machine. And then he said, you're not able to handle CPAP machine. Okay, you go and see her. Maybe she'll be able to help you. If she's not able to help you, then you will have to go to NIMHANS. You probably need psychiatric treatment. Whatever we don't understand, we always say that the patient is psychic, which is most unfortunate. And when he came to me and I saw him like this, in fact, from the moment he entered the clinic, I knew what was wrong. And I saw him, I said, it's because of your teeth. And he turned back and looked at his wife. See, I told you that it is happening because of teeth. So how I restored him, I'll show you. We did all the proportion analysis. You can see the fold in his neck, how bad it is. And this is how the jaw was. The airway was compromised. Hair was falling. Head was moved forward because of the pseudo class 3 and also backwards. You can see that most places you will have a combination. Okay, so lordosis and kyphosis combination. And when he did his airway, his ideal value is 17 millimeter. His was only 10 millimeter. That was the compromise in his about 60% compromise of his airway. This is how his face looked when he came to me, and this is what we did. And this is how it was. And with after restoring the lower, I immediately restored his lower teeth and also the upper jaw. And this is what we could create. And then he actually started feeling so much better, and he was ever so thankful. Otherwise, poor guy would have landed in NIMHANS. Now, snoring. A lot of us have day-to-day life, we hear snoring. What is snoring? Snoring is nothing. When you are in an aircraft and you are going through some kind of, the air blocks, what the sound that you see some kind of vibration in the aircraft, right? The same thing is when the tongue falls onto the airway, the obstruction the sound that it produces is nothing but snoring. So snoring, and as the day goes by, as the vertical dimension drops down or the tongue occupies more and more space, it only increases, and it is a precursor of sleep apnea. So snoring always, most times it leads to sleep apnea, and sleep apnea is a deadly disease. So what is sleep apnea? See, we have a sleep cycle of 7 hours. And in this 7 hours, if an individual does not breathe, mind you, does not breathe for few seconds, and if this not breathing episodes are more than 5 in a sleep cycle of 7 hours, that means the not breathing episodes are more than 5 in a sleep cycle of 7 hours. That means this person is sleep apneic. Now, what all happens in sleep apnea? That means there is a low cellular oxygen. You're not taking enough oxygen in. So when you don't take oxygen in enough, it can lead to impotence, hypertension. It can make the person obese, drowsiness, fatigue, diabetes, motor vehicular accident because you are not well coordinated, you have not slept well, acidity, job impairment because you have not slept well, you cannot function in your work, arrhythmias, changes in heart rate, heart attack, headache, stroke, lung hypertension, dementia, weight gain. So you see, is there any disease which is not there? And mind you, you and I as dentists can fix it beautifully. How? I will show you. Now look at this boy, deep bite. This is how he was. His mother had come to me asking for that she needs a counselor because the child is so cranky. And she said, Sanghmitra, since I've come here, why don't you have a look at my child? I said, okay. And when I saw him, I said, Priya, your son is sleep apneic. So now her antennae went up because his grandmother is also sleep apneic. So after that, anyway, I treated him, and this is what I created. I worked on his deciduous teeth with resin, and I raised his bite. And this is how he looked before and after immediately. And now, this is now with the permanent teeth. This is how he looks. See how happy this child looks now. And this was the I started with, and now his permanent teeth coming in mouth. You can see there's a midline issue here, but when we took the radiograph, he does have a missing lateral incisor, but we're still working on, and I'm sure we will get this. If I had not done this, his first molar tooth would have tilted inside. It would have gotten cavity. It wouldn't have allowed his permanent teeth to appear like this. So this is where we chip in and we start working at a very tender age. So look at his spine, what happened to his spine. You see this curve here? It's quite accentuated because it is taking the jaw forward, because child cannot breathe, right? So he's bringing the jaw forward to make the airway patent. So now you see how this curve, there has to be curve, it cannot be straight. So this curve has softened quite a bit, and you can see his air pipe opening. Now, when we did the analysis, I have it. So his analysis was 9 millimeter, and I could take him to 14 millimeter. It was 11 millimeter, his lower pharyngeal width, we could take it to 12 millimeter. So did I get this one? I am almost nearing, but he's still growing, and I'm sure we will get him right. Now, I forgot to put the picture. Okay, so this was a case of a deep bite, and this is how with the resin we raised his bite like this. And now again, this person had gone through braces twice and it didn't work. And then finally he refused for braces. So we are doing with overlays. And this is what happened to his face. You can see the face has become like this. And look at the way the nostrils are staring at us, and see how the nostrils have softened up. So this is what happens when we do the bioengineering. Look at this smile, and look at now actually he's modeling. Can you believe this? And this is how it was. I wish I could show you the eyes. The eyes was barely open, and now he looks so good. But the best part is, look at this is a cervical spine. And look at the space here, and look at the space here. This is the fold which I showed you in many cases. When the head falls back, what happens? You get that cleft here, the cleft here. Look at the cleft completely disappeared. See the beauty of this. And see here, you can see that this height is less and this height has increased. So this is what goes on to show that how cervical spine gets affected when we work on the teeth, when we increase the height of the teeth, when we do the bioengineering or expand the arch correctly. So this is where it is most important. And his before procedure, it was 12 millimeter. After the procedure, it was 17 millimeter. His 9 was 9 millimeter. Then it became 13 millimeter, the lower pharyngeal width. Ideal is 17 to 20 and lower is 10 to 12. Now, as you see this boy was 32-year-old and sleep apneic. He was using sleep app machine. We redid his sleep study polysomnography, and it turned out that he is no more sleep apneic. So we live in I mentioned, we live in an aesthetic area. Looking good is most important for us. So you see, this person came to me, she smiled like this. She's in a very high position. And she said, I don't like to smile. Can you do something for me? And when I saw this, I said, this is class 3. So as earlier also we were discussing, as dentists, we cause more damage to the person than good. So what kind of a damage her dentist had caused us? She had spacing here. Somebody went ahead and gave her a bridge here. Then if you see here, we never, even if we touch canine, you have to give a slide here, because you do not want to, this is the canine being on the side, you don't want to involve canine any way in making a bridge. And whoever has extracted her first premolar did it so badly that completely the bone was damaged. And she was in a class 3 relationship. As you can see, the 6 is here and the lower 6 is here. Way ahead, the left side also same situation. The mouth was an absolute mess. And then we treated her, and she's still going through the treatment, and this is what I created. And this was her smile, and this is how the smile is. So this is how the aesthetics you can create. And this boy was, the mouth was, he's a good looking boy, and he had this deep bite. Again, he's going through braces with us with the bioengineering in place. But when I did the test drive with the bioengineering part, this is what I created. And see the best part, what happened to the here. Look at this part of his mouth. It looks like here he has a bird face, and here it looks like this non-surgical, orthodontic surgery. So this is the magic we can create with bioengineering. And we always say that we smile with eyes. Tell me which plastic surgeon on this planet Earth can create, make the eye from here to here. Look at her eyes. Look at the wrinkles have gone, reduced quite a bit. Here the eye looks so small and eye has opened up. So this is what we can create with bioengineering. So I think this is all from me, about bioengineering from me. And now I am ready to take questions. This is my contact details, my email ID, and my cell phone number. You can always message me. I'll be always happy to help. Yes.
Thank you so much, Doctor. I think we've had a captive audience. People have been extremely engaged by the scope and the depths to which bioengineering can change all of our lives as dentists and definitely our patients' lives as well.
Sure.
So, guys, if you all can ask questions in the chat box, that'll be great. Even mention your feedback. What do you think? Dr. Sanghmitra has been speaking for the last 60 minutes, and she's literally blown our minds in terms of so many things that we may have heard of, but it's never come to us as a integrated concept the way she's presented it today. So I'll just read out some comments for you. Dr. Gagandeep Kaur is saying amazing session, taken miraculous cases and treatment plans. Maitri is saying, as usual, good to hear, Dr. Sanghmitra. I am up at 6:30 a.m. UK just to hear Sanghmitra.
How sweet, Maitri. Thank you.
And
Okay.
Bhavani is saying it's a very nice lecture, really eye-opening. Thank you so much for your feedback. Dr. Kathy Shah is saying, awesome, ma'am. Preeti has a question for us. How do you convince your patients for treatments like splints or overall corrections when their chief complaint is unrelated? Like if somebody comes to you with maybe something really small, then do you end up taking them down the bioengineering route, and how do you convince them for splints?
Yes. So when this lady came to me, that 63-year-old lady, she had a tooth pain. Okay, and I ended up straightening her leg. She could prevent her knee surgery. So how when we were talking, and I did all the examination, we took the pictures and stuff. So whether patient comes for anything in my clinic, the protocol is take the OPG, take the pictures, and in pictures, if I notice something, then she said that she has a problem. She cannot, she snores a lot. So, and the husband and wife are sleeping in separate rooms. So I said, her teeth weren't bad actually at all. So we did her proportion analysis. I mean, she's a beautiful woman. But when we did airway analysis, she had 50%, less compromised airway. So that's when this was case purely done for the airway. But with that, her shoulder pain went away, her knee became straight, her leg became straight, and all of that happened. So basically, if you have these protocols in place to take the OPG models and pictures, then it's very easy to convince. And initially, when you talk to the patients, then you best thing is to go and ask them to go to the net and see that whether it is related to teeth. And most of the times you will see that they know, they don't fuss so much. But when I started my career, yes, it used to be a challenge because they would never relate to, they wouldn't even give a correct information. And then second setting, third setting, when they come or they go back home, they think about it, and then they would call up and they say, yes, I'm coming back for the treatment, help me out. So I didn't even bother to take anybody's feedback. I have very few feedbacks. But then when I started seeing these changes, I mean, very actively, I started documenting these things from 2017 after Maria's visit to India. So that's when I, otherwise, I mean, treating cases from 2012, but very active recording of cases is from 2017. So when you do that, it's not difficult. Let me tell you, it's not difficult. And if your patient has any issues, just share my 1 or 2 cases with them and they will fall in place. I mean, I think for you guys, it is, much easier now. We were the, when you start something, it's always challenging. I think we are through with that challenge. Yeah.
I think now you're there to show the way for everybody.
Yeah. Yes.
So we have a couple of questions on how do you do airway analysis from Neema Mehta and Dr. Khyati Shah. Both of them want to understand how is airway analysis really done.
The shortcut is to send them for CBCT of airway. Yeah, they will do it. Okay.
Right.
But if you want to see what changes happen to the neck, I'm a person, I still like lateral ceph airway done, which is done by our orthodontist. So because I like to see the changes in neck, like I showed you one of the case, the fold went away and the space between the vertebrae increased. So all that is done on the lateral ceph, and it is taught actually in orthodontics. So your orthodontist will be able to do it. Yeah.
Superb. So I think that's a useful tip because another thing that we discussed in the live was that it's all about interdisciplinary dentistry as well.
Right. Yes.
So your orthodontist has to be a team member who can help you out with this.
Yeah.
There is a question from Huma. As a BDS practitioner, how can we inculcate the bioengineering procedures in our practice? Any books that you would suggest? And even Dr. Bhavani is asking something similar where she says, where can we learn more about bioengineering and its practical use?
There is no book as such on bioengineering, but I feel that as a BDS, you are at an advantage, because your mind is not corrupted by the specialization. That's one thing which I would like to tell you. You're very lucky. You can do anything. I'm a maxillofacial surgeon. When I do a prosto work for somebody who turns around and says, "You're a surgeon. Why are you doing this?" So that was one reason I think I didn't leave this country, because this country gives you freedom. If I was elsewhere as a specialist, probably the specialists are like with blinkers. You can't turn right and left. If you are a periodontist, you're only look at gum. You don't give a damn to the tooth, right?
Correct.
It's something like that. So as a BDS, I think you are at an advantage. And this is a science, I think, like how it's in bits and pieces on the internet, so which I put together everything. So it happened by fluke, since we were working on occlusion and we had our share of failures, as we discussed in FP Live also. So like if you do a rehab work, suppose, and you are doing a bite raise so we did in the past, we did bite raise only when the person came in. We didn't have the concept of shimbashi. So somebody, you must attend conferences. You may not, all the lectures may not be useful, but that 1 or 2% which you take away from the conferences, I think they are life-changing. So I think that has made a huge difference in my life. And of course, teaching. So when you teach, you learn. So these are the things, that has worked. So as such, there are no books on bioengineering or neuromuscular dentistry. I think, in prosthodontics, a lot of talk is there about this, about neuromuscular dentistry. So you can read on that, but I doubt somebody has done this kind of extensive work. Even I've not seen this kind of, from head to toe changes. Yeah.
So, doctor, what they are asking is that if you could conduct a detailed course like this, it would really help some of the interested participants. So, if you could inform us whenever that next course occurs, because definitely bioengineering is a deep concept that even you've been doing for so many years.
Yeah.
So, for anyone, to be able to apply this, let us know when and how you do your
So
consultation.
you know what you did, as I said, note down my number, send me a message. So I'll make that list, and I'll the minute I feel that yes, now I definitely don't want to take more than 10 people at one go.
Right.
And I think I'm ready for online thing, because we were to launch these courses in 2019 or 2020 beginning, but then the COVID hit. So we thought like how will we teach online, but I think now we are ready for that. So I'm ready to do it, but not more than 10 people. So give me your names, and my number, I think it's noted down, right? 98453 73378. So contact me on this number, and yeah, so when we have number, we will go ahead with this. But initially, I think the teaching is the analyzing phase. See, if your diagnosis is correct, your outcome is going to be right. And the beauty of bioengineering is you don't harm anybody. And the results in 150 cases, are they as magical as, because we always showcase our best stuff, right? To be very, very honest. But are the results, all of them, very magical? The answer is no. The improvement, I would say, is about 30% to 90%. So that 30% of lift itself is quite amazing. Now, why does it this one in? I'll also tell you the challenges that we face in women. The moment you give them that, the test drive you do, and you give them that this is where you will be, they don't like it. But please remember that to make your biceps also, you take about 4 months. You can't make your biceps overnight. Okay, I did my weights now and I have biceps. It doesn't happen, because it's all muscles, right? So so muscle deprogramming does not happen overnight. So you have to, as I also mentioned during this presentation, you have to be like a counselor. You have to be constantly talking to them. But yes, I also feel the patient's challenges, because I treat whole lot of high profile patients, and they are public figures. They can't step out with the, teeth looking tall and stuff. So in those cases, wherever I have dropped height, I don't like it, honestly. I have not been able to give them that magical, but they are very happy with the aesthetics part. They think it is very good and stuff. But if you ask me, am I happy? The answer is no. I always feel that, if they had, stayed with me, where I wanted to take them, I think things would have been much different.
Right. So there's the seeking perfection will always continue, I guess.
Absolutely, absolutely.
Right. So we have two questions from Dr. Gagandeep Kaur. One is that the face divided as RR or LL, as you had shown, does it indicate the faulty side? So when you superimpose the right side on right side, left side on left side,
These
does it
I showed
indicate?
you as a what do you call, asymmetry.
Example. Right, right.
There's an asymmetry. It's not that the right and left is matching. But should it match perfectly? The answer is no. Rule of 80-20 apply, because most of us are right-hander. So when we work
Correct.
with the right hand mode, we turn our shoulder towards inwards, right? So that shoulder will turn inwards. That also causes asymmetry. Then the way the teeth alignment is, that will cause asymmetry. So the 80-20 rule applies. As long as the 80% symmetrical, it's fine. But if it starts going down, that, if it becomes 70-30 or 60-40 or 50-50, then it's not good. Then we need to work. Then we need to check. You
Got it.
see somebody's eyes becoming smaller. So somebody, one case I did, and I went for some meeting, and I met this MD of Juviderm.
Right.
So when I showed him the result, and he said, Sanghmitra, please tell me you used my fillers. I said, no, I didn't use your fillers. This is my bioengineering that created the result. So he said, don't show it to anybody. My people will stop using fillers. But let me tell you something. Fillers, Botox, everything has its own place. You have done the bioengineering, and then you're tweaking you want to do with Botox, or you want to do with fillers. Imagine how beautiful result you will create. Yeah. So
Right.
it's not that just because you're bioengineering, you're whole soul of everything. No, everything has its place.
Perfect. So, Dr. Gagandeep Kaur is also asking, in Rio, we make occlusal splints. And as you had shown the high points, do we remove those by smoothing with burrs, or do we keep them?
They are not high points, they are contact points.
Their contact.
See the buccal cusp of maxillary teeth falls in the central fossa of mandibular teeth, right? And the buccal cusp of mandibular teeth falls on the central fossa of the maxillary teeth. So that is what we have replicated. That is what it is, a removable ideal occlusion. Ideal occlusion is like that. Lines in front, dots at the back. So those lines and the dots have been created. Otherwise, you can take any splint. There are zillions of splints in the market, you know. And in fact, I worked with this. There was a splint called night eye, I think.
Yeah.
Right. Yeah, I lost 3 patients because of that. And then I met this gentleman. He was from Canada.
NTI. It was called
NTI.
Yeah.
Right. Long ago, I think it's almost 10 years, and I
very
don't use that anymore. So when I spoke to this gentleman from Canada, we had gone to Nepal to learn, this sleep apnea. There were a lot of physicians and people from there. They like to come to Nepal because from there they go to Everest. So this workshop was conducted in Nepal. So we also went there. And I was having this discussion with Larry because every case he was giving NTI. So I said, NTI works in all your cases. Now, the minute I said that, so he said, why, what happened? I said, no, like this, it happened. I lost 3 patients because of NTI because their jaw swung to one side. So when we started doing bioengineering, and then there was some Michigan splint, and I am a case of bioengineering, so I have used everything on myself. And I tell you, when I had that Michigan splint, I had the worst nightmare of my life. It was really bad, really bad. And then I went through Rio, and then after that I went through the bioengineering, and that sorted out my problem. Yeah.
So I think it's important to even experience these treatments ourselves. In fact, one of our participants is asking also that what are the signs to look for in a posture and body before a patient even opens his mouth? Like you described a case where the person walked in and you already knew something was wrong with his teeth. So for us as dentists, when somebody walks in tomorrow, let's say at the practice, what are those red flags that we should be looking out for?
The person is standing and you look at the patient, where the leg is going, okay, or walking and standing. Right. That's one part. So you must watch patient how they walk. And like I go to the park and I keep watching the people, how they walk and how their head is. And I kind of know what kind of occlusion they would have. Then when the person is facing, look at the asymmetry, look at the eye, if there is any eye is symmetrical. Eye is a big giveaway as the age progresses. Then of course, lower third, always look at whether it is a bird face, it is a straight, or it is, going in class 3. And the way they talk. So if the person has gone through ortho, then it is very confusing. Otherwise, I think you can, even sitting out without patient opening the mouth, you can actually diagnose the case, what kind of occlusion the person will have.
Got it. And I think one of the last questions is, what should I do if my dad or like a family member has sleep apnea? How do I proceed? Like once a person has been diagnosed with sleep apnea, as a dentist, what can I do to help them?
See, if you can actually help the person big way. You must be having, if the polysomnography is done, get it done. Then also get the airway analysis done, either on a lateral step by a orthodontist, or send the person for the CBCT, which is the straightforward way to do it. And then make a Rio for him. And then once he starts feeling comfortable, then convert whatever you have gotten in Rio, convert that into use the overlay. If there are missing teeth, give implants. Please don't cut teeth for bridge. Bridge is a no. You don't want to take away enamel. If you take away enamel, it's a disservice. It's not service. Let me tell you.
Got it.
Yeah.
Great. So those are some of the initial steps. And how long would we leave a Rio in place for something like
4 to 6 months? 4 to 6 months is the time. Yeah.
With recalls of roughly how often?
A first call, the moment you give Rio, call the patient next week. Okay. Right. Then after that, make it bi-weekly. Then after 2-3 months, make it once a month. So once the person is comfortable, and feedback is very important, that whether it is doing something. Very,
Got it.
very, I don't think, I mean, very, very rarely it happens that patient rejected, because, and those are the patient who's very, very fat, and or they have a very strong gag reflex. They are the ones who say that, putting anything in mouth, they feel like throwing up. So in those cases, I think I have done a couple of cases. That is after a lot of experience. I don't advise anybody, I shouldn't be mentioning also that even Rio, I don't do for them. I straight away go ahead with
Restoration.
restorations.
Got it. And Dr. Kathy Shah is asking, what if the old bridges are already existing in the patient's mouth?
Cut those bridges and give them implants.
Okay.
Yeah,
And
because always remember, our every tooth is force coded. When I say force coded, you know that the first molar tooth can handle about 200 pounds per square inch of force. Then as you come forward, the central incisors are 25. So as you go back, if you are restoring, if you are giving a bridge of say 6 is missing, and 5, 6, 7, if you do, 5 will pack up, because 5 cannot. 5 is bearing the load of 6. It is shared by 5. So 5 will pack up. You don't want to do that. Cut that at 5. You don't even have to cut the crown. Cut at the distal part of this and smoothen it, round it off, and then give an implant there. Like how I did it, the case I showed you, that elderly gentleman whose legs straightened up. He was losing that tooth, that bridge actually. But yeah, that's how I restored him.
got it. And any good labs for Rio?
That's a
Tough one.
that's a tough one. That's very difficult to tell. I think Illusion does in Bombay, Rio. Yeah.
Right. So it's location dependent, largely.
Location dependent. Yeah.
Got it. But in the course itself, you'll be teaching how to make the appliance
Yes.
within
You can make
custom
it
making.
yourself also. I mean, if we could make dentures in our college days, why not Rio? We have done a lot of times. We have made it in the clinic.
Lovely. Great. So I think that answers all of our questions. And I think we've got some lovely, thought-provoking comments as well. And thank you so much, Doctor. I think we've taken up 90 minutes of your Sunday today, but it's been really something that has gotten us all thinking that there is a different way of practicing dentistry. There's a whole world beyond the one we currently see. So I think many of us will get in touch with you for the detailed course, of course.
Yes.
And lots of food for thought for all of us. And hopefully we're looking at our patients differently starting tomorrow. Thank you for this lovely event as our flagship event. And it'll always be something very memorable to us. So thank you so much for being one of our first women speakers and inspiring so many other women.
I'm glad. Thank you so much, everybody. Yeah.
Thank you.